Okay, back with you on the Bronx Buzz. We're always excited to show you new art stuff in the Bronx, and this is particularly unique and important. And so we will say a good evening to the Care Experience Officer at North Central Bronx Hospital. That is Alisha Bronne. Alisha, nice to be with you. Nice to see you.
Hello, thank you for having me.
And an artist, an artiste. It is Sophia Victor. Sophia, thank you for taking the time to be with us.
Thank you guys for the opportunity.
Appreciate it. Alisha, I was talking about how unusual it is to have a mural painted in a hospital, but apparently I'm somewhat wrong because you folks at NCB and the New York City Health and Hospitals Corporation have been doing this. Tell us about the large waves of healing, and then we'll focus in on what's going on at NCB.
Right. So, New York City Health and Hospitals has had arts in their facilities for many, many years now, and we continue to build through our community mural project, which is something that we're going to get into with the mural that we just completed at North Central Bronx. So, you'll find many different pieces throughout our hospitals and throughout all of our facilities across New York City. And it's thought to be one of the largest art collections in New York City. So I encourage everyone to check it out and see what pieces we have available.
Absolutely. And let's hope you're checking it out as a visitor and not as a patient. But if you
Right.
are, that's okay too. But why would, now I got the numbers here since 2019, which makes it 5 years, and there are 37 murals created at New York City Health and Hospitals. Why is a hospital a good place for a mural?
Right. So when you think about experience, you think about the senses. What do you see? What do you feel? What do you hear? What do you smell when you're walking into any establishment, but much less a hospital? It's not known to be the happiest place. And so, what the Community Mural Project does and what artwork in the hospital does is bring some brightness, some vibrancy to our hospital spaces, and then it can really help with our patients and our staff to minimize the levels of stress that they are feeling. You know, seeing a beautiful piece of artwork can immediately change your emotions, can change your thought process. And that is why we have been working so hard to put these beautiful pieces throughout all of our facilities to create that experience for our patients, our visitors, and for our staff members.
I got two questions to follow up with. One is the value of art in healing. People, you correctly, of course, mentioned that people in hospitals have all kinds of stress. Even the people visiting have plenty of stress very often, and I guess it's welcoming, right? Maybe you could talk a little bit more eloquently than I can about why this really works in this kind of a setting.
There has been many, many studies that have been done, and New York City Health and Hospitals Arts and Medicine team has done a lot of research themselves on the effect of artwork within healthcare, not just art, but music, and all things that fall into the arts category. And so we've tried to incorporate these things within our facilities, again, for both patients and staff members to help with stress levels, to help with whatever they may be going through at the time, and just again to beautify our spaces.
The other question I have is almost a personal one. It's so interesting. I introduced you as the Care Experience Officer. So this shows, as if we need to have it demonstrated, that NCB and New York City hospitals really they want to make the experience healthful, and so that people are shown that you actually care about them, and it's not like it is a bureaucracy, we know that, but that there's real care, there's real human beings behind it.
Absolutely. We want to create a healing environment for anyone that's coming in. And we want to create something that our patients and our staff members can see themselves in. We are a community hospital in the Norwood community in the Bronx, and we want what we put up in our hospitals to be relatable to the people that we serve.
Right, so that they feel welcome. Sophia, I first of all, just your own background as an artist, and then we're going to talk specifically about this project.
Okay, cool.
So tell us about you as an artist. You've been painting for a long time. You've done murals. Just a little background.
Yeah, so by the grace of God, I've been making art for over 20 years,
Good for
and
you.
it was kind of a gift that I stumbled on. I wasn't really interested in art in the beginning, and then ended up getting accepted for LaGuardia High School for art. And little by little, God revealed to me that I had a gift. And as soon as I discovered that I could paint, my dad got me enrolled in a mural program, which
Ah,
still exists in Brooklyn. So I went from working on, 18 by 24 to immediately transforming community centers. And this was happening at like the age of 15. And so
wow.
working big and community art practices and mural projects has been a part of my practice
For a long time.
for a long time.
And
Yeah.
this project, you know what? Maybe Anderson, let's just show pictures so we're not talking like people don't know what we're talking about. Here it is. Here it is.
Yes.
What
Yes.
what what do you think about when you look up and see it now, even in this context?
I don't know. It's like it's always really exciting to see the finished product. As the artist and like the lead artist in something like this, I feel like the process is a lot more for me, and then the product is for everyone who will see it for forever.
Well,
But then
that's
also,
excuse me, that's a wonderful perspective. So the process is like my I got to deal with that,
it's a
but
pretty intimate process.
but
I
but
like to go
I want
ahead.
to ask you about that specifically. In this case, and I don't know which one of you is better able to explain it. You asked for community input as to what
Oh
should
yeah,
be in there.
right.
So, Alicia, maybe you could just talk about that, and then we'll talk to Sophia about hearing all that and then figuring out how to do it.
Yes.
Yeah, so we had several focus groups going into this session and this project, which consisted of members of our staff at the hospital and members of the community and our community advisory board who represents our community. And Sophia did an amazing job of taking all of our input. We had different art homework and art lessons, and we put together our own art pieces, and Sophia was able to take elements of all of those pieces and put it together into this
Wow.
mural. And so anyone who's walking past, we definitely see a piece of ourselves and our hospital in that
And
mural.
of course, they see themselves in the community. Alicia, give us one example or two examples of what people asked for.
Oh, the blue waves,
Waves
that seems to be consistent in our
to be
poetry writing in,
transported somewhere else.
yes, for sure.
And so then, Sophia, as opposed to you creating the whole thing, how much of a challenge is that for you to get kind of conscripted to say
Right.
you've got to create it like this? This is what we want.
Well, this is more like the design process is truly collaborative, right?
Anderson,
And so
pop the
like
thing up there so we can enjoy seeing it more. Go ahead.
yeah,
I'm
so the
sorry.
design process was truly a collaborative process. I just finished obtaining a master's in art therapy, so I try to be really mindful and sensitive to like what everyone in the room needs and wants, not just in like what do you want to see in the mural, but like how do they feel comfortable approaching art, especially if someone has never painted before or made any type of art before. So we worked with like oil pastels, we worked with collage, and how we started, I would just ask everyone, hey, like what is it that you want to see or feel when you look at this piece? Because if I never come back to this hospital, at the end of the day, you guys are here every day. This is your mural.
Right.
And so they would shout out hope, and we want to feel happy. We want to see smiling faces. Um, we
Wow.
want to see community, diversity. So
And
they
and
would,
then
yeah,
and I'm sorry to interrupt because we always end up running out of time because we get
yeah,
so
yeah, yeah.
involved.
Go ahead.
But and then you worked with it, like you didn't just paint it; there were other people painting it, so it was a community. Alicia's
Yeah,
shaking
yeah. So
saying yes.
those words turned into a bunch of images, which they also came up with. And then they put those images together, and then I reworked their design. And then we had a paint party, which was a lot of fun. I've done community paint days, but this was the most organized, clean, fun, drop
Wow.
in, drop out. So
Well,
if you could imagine a giant coloring book of the mural and a bunch of people grabbing a color and kind of like
What
working
what what
with.
a what a great metaphor, a giant coloring book. I, did anybody step in the bucket? I
No,
hate
thank God.
that.
Thank God. I saw the carpet on the floor and I was like, oh, Lord help
Oh
us.
no, we're
But
gonna make a
no
mess. Oh,
spills, no crazy accidents.
maybe next time we should extend the mural to the floor so that the carpet is covered.
Yes.
Alicia, what kinds of responses have you gotten? Have you gotten any responses? Do you get the sense that it's been a successful project?
It has definitely been a successful project. The responses have been very positive from the time the mural went up, even until now. Everyone that's seeing it has nothing but great things to say. They're so happy again to see themselves and the community and the people that they serve in this mural.
Especially people who may have actually contributed it or painted it or all those kinds of things. Where in the hospital is it? I'd like to come by and see it. I assume the general
Yeah.
public can get in and see it.
Absolutely. It is located on the third floor of our
Okay.
hospital, and this was strategically placed because the third floor, we have many of our outpatient practices where
Mm,
there is tons of foot traffic. A lot of our patients are coming in to see their doctors. On the third floor, where we have a lot of our outpatient services. And so we wanted it to be an area where a lot of people would be able to view this piece and
Right.
again, see themselves in it.
Yeah, I think it's great, and I think about medical facilities maybe that I've been through, and not at NCB, but in other places, and I wonder how I would feel if I walked in and saw, and you could see there were real human beings in there. Of course, there's diversity in there. Welcome to the Bronx, and all that kind of stuff. Sophia, just to wrap this up. Um,
yes.
do you have other projects in mind, or like where's the next mural? You're going to come to my neighborhood and do something at the library building or something? I mean, what do you
I
got? What's
I
going on?
do I do have a mural that's gonna pop up in Brooklyn. It's actually already installed. I can't mention the location yet, but
No problem.
literally, if
Oh, if
anyone
it's in
follows my
Brooklyn,
Instagram, I am web paint. I'll share when we're gonna celebrate that. But in Bedside, Brooklyn, there's a new mural
wow,
that hasn't
beautiful.
been celebrated yet, and I'm developing a body of work for a solo exhibition for the spring.
Wow, and you just never stop. This is what you do, right? You can't
Yes,
not be doing this. I get that
yes,
sense.
yes.
Um, Alicia, and then the last thing I just want to say is to thank you and all the people at North Central Bronx. The work you do, work you all do, is so important. We need it so badly, and when it's done by great professionals like you and all your colleagues, it helps keep the Bronx alive, literally and figuratively. Thank you so much, and
Thank
thank you for
you.
this project.
Thank
And
you.
Sophia, thank you.
Thank you so much for having me.
Great. That will do it, folks. We thank Leo, who was in our first segment and talked a little bit about the South Bronx and these folks who are really doing wonderful stuff in our borough. What a great place, the borough of the Bronx. And so that's it. And if the curtain don't fall and the creek don't rise, we will be back next week. I guarantee it. Good night.